Hello everyone, we are inviting you to a journey into the world of epidemiology, public health, and a topic that affects millions worldwide acne. My name is Joey, and these are my group mates Jensen, Qianya, and Xiaoxiang. We are a group of students from Sunway University studying biomedicine and medical biotechnology. In this video, we are going to go through a few parts which are introduction, epidemiology, pathophysiology, and diagnosis of acne. Besides that, we will also provide treatment options, self-care or follow-up care, and lastly, the three questions about acne. So, what is acne? Acne is a common skin condition caused by clogged hair follicles beneath the skin. Sebum and dead skin cells will clog the pores, and resulting in the outbreaks of lesions known as pimples. Indeed, acne mostly occurs on the face, but it can also appear on your back, chest, and even buttocks. Now I will pass to Jensen to talk about the epidemiology of acne.
Thank you, Joby, for the introduction. So, acne, a common skin condition, affects a significant portion of the global population. It is estimated that up to 80% of individuals will experience acne at some stage in their lives. The prevalence of acne varies by age, sex, and geographic location. Acne is more frequent in teenagers and young adults, with up to 85% of those aged 12 to 24 suffering from acne. However, acne can also affect adults, with up to 50% of women and 25% of men experiencing acne in their 20s and 30s. Besides, males are more likely than females to develop adolescent acne. Post-adolescent acne, on the other hand, primarily affects females. Moreover, acne affects urban people more than rural population, with approximately 20% of those impacted have severe acne, which leads to scarring. Some research suggests that the severity and prevalence of acne may differ between racial and ethnic groups. Asians and Africans are more likely to suffer from severe acne, while on the other hand, mild acne is more common in the white population. Acne development and severity have been linked to a number of risk factors, such as genetics, hormonal influence, food, smoking, and stress. Family history, BMI, certain dietary habits, and menstrual history have been identified as risk factors for moderate to severe acne in teens and young adults.
There are three major factors involved in the acne formation. Firstly, dead cells and obstruction in sebaceous glands result in clogged pores. Secondly, the increased sebum production due to stress and excessive hormone production, specifically androgen, will also cause acne. Study shows that the chemical substance in the body produced when stressed, as well as androgen, can stimulate the growth of sebaceous glands and its secretory function. When increased sebum meets pores, it will lead to acne formation as fatty acids are the nutrient source for the bacteria. Furthermore, the presence of bacteria can trigger immune responses, thereby contributing the inflammatory responses observed in moderate to severe acne. So, if these three factors interact with each other, microcomedones will be formed, and it will evolve and develop into other types of acne lesions, which will be discussed in the coming slides. As discussed, the formation of microcomedone, which is the precursor of acne, can be caused by various factors. However, if no or inappropriate treatment is done, microcomedones will develop from mild types to the severe types of acne. Microcomedones, whiteheads, and blackheads are actually considered as non-inflammatory lesions. Microcomedones is composed of corneocytes and dead cells. It is located in the uppermost region of the pore. Then, if the accumulation of keratinous material and sebum occur, it will convert the microcomedone into the closed comedone, which we call it as whiteheads. Through the continuous distension, and pore will expand, resulting in the formation of open comedone, also known as blackheads. The oxidized lipids and the melanin within the comedone contribute to its characterized dark black color. When the cellular immune responses to the bacteria, it contributes to the development of inflammatory lesions. Firstly, pustules and papules are composed of white blood cells attacking an infection, as well as the waste product from the bacterial reproduction. Eventually, when the follicle ruptures with the release of bacteria, keratin, and lipids into the surrounding skin, it will worsen the inflammation with a subsequent nodule formation. Last one is the cyst acne. They are filled with pus and often painful and more likely to cause scarring.
Thank you, Chenya. Now I'm going to talk about the diagnosis of acne. Acne is typically diagnosed based on physical examination on its appearance. Firstly, if you have small bumps sticking out from your skin, you will probably have whiteheads. Next, the blackheads are the tiny black spots that can be commonly found on your nose. On the inflammatory lesion side, we have papules and pustules. Although both of them are called pimples, they are structurally different. Papules are the small red bumps, whereas the pustules are pimples that contain white colored pus. Next, the large inflamed bumps that feel firm to touch are nodules. Lastly, if you have a softer pus-filled and painful lesion, there are cysts. If you have a cyst, you are better to go to refer to a physician. So I will pass to Chenya to talk about the diagnosis of post-acne.
Acne can leave various scars after healing, which may present as depressed scars or hypertrophic and colloidal scars. Similar to other inflammatory skin conditions, acne lesion may also lead to the development of post-inflammatory hyperpigmentation, which is more common in individuals with darker skin. Other serious acne scars such as ice pick scars, boca scars, and rolling scars are also the common scars left behind if acne was not being treated
There's
properly.
three treatment options that we suggest to the audience. One of it is the salicylic acid toner pads. It includes a stronger acne fighting ingredient than most regular strength pads. It goes into pores to help get rid of and prevent breakouts. Salicylic acid toner pads contain skin cleanser that effectively remove dirt, oil, sweat, and other pollutants from the skin surface and penetrate to unclog pores and break down underneath the skin's oil. It also exfoliates dead skin cells on the surface and aids in unclogging of clogged pores, thereby preventing acne from occurring. Moreover, salicylic acid clears pores of the sebum and bacteria that causes pimples by breaking down the blockage. While for benzoyl peroxide, it helps to clear acne and blackheads that helps prevent new acne pimples from forming and allows skins to heal. This ingredient works by reducing a type of acne-causing bacteria. Benzoyl peroxide has been an important component for more than 5 decades due to its ability to markedly reduce normal acne and non-inflammatory acne lesions and its ability to moderately reduce non-inflammatory acne lesions. Last but not least, it is recommended to use products that contain sulfur because it has anti-inflammatory and antibacterial properties that aid in reducing the size and redness of the blemish. Sulfur is still the most efficient therapeutic agent in acne. It penetrates the skin easily, which has a keratolytic action, hence reducing seborrhea. There is some self-care that we can do when we are dealing with acne. First, keep your skin clean. Gently wash your face up to twice daily and after sweating. Choose a gentle, non-abrasive cleanser. Apply it with your fingertips as scrubbing with washcloths, sponges and other tools can irritate your skin. Second, choose the right skincare. Use gentle skincare products and the ones that says alcohol-free on the label. Avoid products that can irritate your skin including astringents, toners, and exfoliants. This product can dry your skin and make acne appear worse. In addition, identify your triggers that make acne worse. This might include hormonal fluctuation associated with your menstrual cycle, certain foods, or numerous other factors. Finally, get help for acne early. Work with your doctor if you notice that your pimples are getting worse or not responding to treatment. Now I'll pass it to Jensen.
Thank you, Joey, Chenya, and Xiaoxiang for the valuable insight regarding acne. So here are some few questions to test your knowledge regarding acne. Number one, what is the pathophysiology of acne? Acne is caused by a combination of factors, including excess oil production, clogged pores, bacteria, and inflammation. Question number two, What are some of the most common topical medications used to treat acne and how do they work? Some of the most common topical medication used to treat acne include benzoic peroxide, retinoids, salicylic acid, and antibiotic. Benzoic peroxide and antibiotic work by killing bacteria, while retinoids and salicylic acid work by unclogging pores and releasing inflammation. Lastly, what are some of the lifestyle factors that can contribute to acne? Several lifestyle factors have been identified as potential contributors to the development of acne, including stress, dietary choices, and hormonal fluctuation. The, pho- the phenomenon of stress has been seen to have a positive correlation with the production of oil and increase of inflammation. Similarly, it has been noted that a consumption of a diet rich in sugar and processed foods can potentially contribute to the development of inflammation. Lastly, hormonal fluctuation, such as those experienced around the onset of puberty or during pregnancy, may potentially have a role in the development of acne. These are our references. We hope that we gave you a clearer understanding of this common skin condition called acne and its underlying causes and the various treatment options available. Remember, while acne can be frustrating, there are effective strategies that can improve the condition and boost your confidence. If you have any other questions, your dermatologist or healthcare provider is a valuable resource and can provide a personalized guidance tailored to your unique situation. Thank you for listening.